Dental implants replace missing teeth. The design of a dental implant is based on the design of a natural tooth. A natural tooth is one piece commonly described as having two main parts. One part is the crown that sits above the gums. The second part is a root that sits securely in your jawbone. A dental implant treatment may involve several pieces. However, it may also be described as having two main parts. One part is a restoration that is custom fabricated to match the shape of a natural tooth crown. The second part is the implant that replaces the function of a natural tooth root. Implants are made of titanium or titanium alloy. Unlike most materials, our body normally accepts titanium without infection. The first phase of implant treatment involves creating an opening in the jawbone in preparation for the implant. The implant is then placed, followed by a healing cover. Depending on the implant system, the gums may be sutured and a temporary denture placed. The site immediately begins to heal. A process known as osseointegration takes place, where bone molecules begin to attach themselves to the titanium surrounding the implant. It usually takes between 2 to 4 months for the bone to securely bond to the entire implant surface. The final phase involves the custom restoration being fitted and securely placed. All our teeth are held securely in the jawbone. Disease, decay, or trauma may lead to tooth loss. If a lost tooth is not immediately replaced, the surrounding bone begins to collapse and shrink. With no adjacent support, the neighboring teeth begin to drift toward the area of the missing tooth. The amount of bone loss and the pattern of drifting will vary depending on the individual and the location of tooth loss. The drifting of one tooth may lead to the drifting of several teeth, resulting in a significant amount of movement. Periodontal disease may begin to form after your teeth have drifted and erupted, because it becomes difficult to properly clean your gums and reach all of the pockets in those areas. This may lead to tooth decay, receding gums, and further tooth loss. If you have lost a single tooth, you have various tooth replacement options to consider. One option would be a single-tooth partial denture. A major consequence of this option is the bone loss that occurs due to the absence of the natural tooth root. Biting forces will cause the partial to move and shift because its design lacks a secure connection. Many partial denture wearers may also experience discomfort and gum irritation. In a second option, known as a resin-bonded bridge, a high-speed drill is used to cut into the back of the neighboring teeth. A prosthesis is then added to the back of your natural teeth. With the absence of the natural tooth root, the bone above the crown begins to shrink. Everyday biting forces will also begin to apply opposing pressures that will loosen the bond over time. The third option is referred to as a fixed bridge. A high-speed drill shaves down a significant amount of the neighboring teeth's natural structure. This prepares the teeth for the fitting of a fabricated 3-unit bridge that is cemented in place. However, bone loss soon occurs, and plaque buildup is common below the margins of the crowns. The neighboring teeth lack adequate tooth structure, which makes them weaker and more susceptible to tooth decay. Tooth decay leads to root canals, and a root canal can eventually cause additional tooth loss. The bridge can be repaired by the preparation of an additional tooth and the cementing of a 4-unit bridge. Additional bone loss occurs, and there is still consequences of additional tooth decay and root canal disease that may lead to another failed bridge. The fourth option replaces the natural tooth root with a dental implant that is inserted into the bone. An abutment is secured to the implant, and a crown is secured to the abutment. The dental implant option closely mimics the design and function of your natural tooth. The dental implant is the most secure option, with a solid foundation of bone that keeps it stable, withstanding the forces of biting and chewing. An implant feels and functions like a natural tooth, and it is proven to outlast all other tooth replacement options. Natural teeth are held securely in place by their roots in the jawbone. Disease, decay, or trauma may lead to the loss of all of one's teeth. The roots had previously stimulated the surrounding bone, maintaining the jaw's natural shape. However, with no roots in place, the jawbone will begin to resorb or shrink because it no longer serves the purpose that nature intended. Many years of bone loss may cause your face to change. Your mouth and jaw appear to collapse, your lips look thinner, and there is an increase in wrinkles near the mouth and neck. If you have lost all your teeth, there are various treatment options available. One option would be the placement of a removable denture. A denture sits loosely over your gums, with no secure connection to the jawbone. Another option would be choosing a dental implant-based treatment. Implants are secured to the jawbone, replacing the function of your natural tooth roots. A removable denture is custom-fitted to each patient's jawbone. But as it shrinks over time, the removable denture becomes loose. This movement may cause soreness of gums, difficulty in chewing, and trouble speaking. Over the years, the denture may need remodeling so that it fits the changing shape of the jaw. This can be very frustrating for a patient who experiences this cycle of denture maintenance for many years. With bone loss, it becomes increasingly difficult to stabilize the denture. The remaining bone may not be thick enough to protect one of the jaw's main nerves from the pressures of biting and chewing. This type of pressure may cause extreme pain and discomfort. The only proven way to prevent or stop bone loss is to replace your natural tooth roots with dental implants. One option may involve the placement of 2 or more dental implants. Special attachments are placed over the implants, making it possible for a customized denture to be secured in place. This is a connection type known as the locator attachment. The denture may be removed by the patient for cleaning. A second option may involve the placement of 2 or 3 dental implants. Ball-shaped abutments are placed over the implants, and a customized denture is then designed to snap securely into place over the abutments. This is a connection type known as the ball and O-ring attachment. This denture can also be removed by the patient. A third option may involve the placement of 4 dental implants. A customized bar is fabricated and attached to the implants. A denture is designed with clips that securely snap into place over the bar. This type of connection is known as the bar and clip attachment. This denture may also be removed by the patient for cleaning. A fourth option involves the placement of 5 or 6 dental implants. Specialized attachments cover the implants to facilitate the placement of what is known as a fixed detachable denture. The denture is designed with small holes that allow specialized screws to pass through and connect it directly to the implants. This is a very stable and secure treatment option that can only be removed or detached by a dental professional. A fifth option is known as a fixed implant bridge, and it commonly involves the placement of 8, 10, or 12 dental implants. Standard abutments are attached to the implants to prepare for the placement of the crowns. The crowns are then cemented to the implants as one piece. This option most closely resembles the look and feel of natural teeth, while virtually eliminating bone loss. Dental implants will provide you with a stable and long-term solution that reduces the pain, discomfort, instability, and bone loss that denture patients experience.